7:34. It's the Link on the Breeze, 93.9. Let's get Dr. Janna Manglona, Public Health Medical Director on the KUAM News Zoom room. Good morning, Doc.
Good morning. How are you all?
We're hanging in there. It is what it is.
Right.
The best way to put it.
I think it's the first time you mean it. I'm hanging in there. We used to say it to be funny. Now we're not.
Yeah. So literally, right? And we'll just get right into it, Doc. I know your time is valuable. We got a lot of comments from people who got tested at the various mass community testings last weekend, and they're blowing up the feed saying they're waiting for the results. They haven't heard anything. So if we could just start with the status on the backlog of tests from the community mass testing that have yet to be run by public health.
I don't have the numbers. That's Annette Uggan takes care of the numbers of it. But I do know that they're working every day to get the backlog down, get the tests run, get the patients called. And I believe the individual clinics are responsible. For example, if you had it done at AMC or FHP, wherever you had it done, I believe the individual clinics are doing the calling. And they're doing that to help out. There were a lot done that day, and the manpower to call everyone is quite extensive. But they are getting caught up. But then we have a daily limit, and you have to know, too, that we have about 7 clinics feeding into the lab every day. So even if you run 200 or 300, you have 200 or 300 more coming in. So they're doing their best to try to get more tested, so that we can get more of the tests run so that we can get that backlog down.
Do you know, Doc, maybe just an estimate how many of the tests, like, for example, we ran a bunch of tests yesterday. How many were from current testing through close contacts or contact tracing, and how many were from the mass testing conducted last weekend?
That's a net question. Okay. I don't have those numbers. I could get those, but I don't have those for you now, and I can text them to you later.
But fine.
That's where Nettie comes in. She's the number cruncher in the lab.
Right.
Doc, I just want to ask, with the surge, all the craziness that's been happening, what is your priority number one right about now?
I think because there's a fire burning, priority number one is put the fire out. And then we can sort things out after that. That's the number one priority because it's brand new, acute. We've got to stop it now. And that's why the governor did what she did. We can sort out in the meantime, but stop it. And it's out of control because the people are out of control. No matter what we've done, ultimately, it's the front line, which is the community. It was up to them to fight the war. And how do you think, kick it around, how do you think they did? Doesn't look too good.
Yeah.
But there's nothing more we can do. What you're seeing now, thank your community for it. We didn't do this. And we've done everything we can to equip our hospitals and equip our clinics and equip our providers. And public service announcement. Finally, enough already. Do what you know you need to do. And if you don't do it, you're going to have exactly what you've got right now. I mean, congratulations. If this is what your goal was while you're preaching about constitutional rights, to me, it does just quit killing people, quit making them sick. Then we can talk about constitutional rights. That is so far in second place. Number one, we're trying to survive this and trying to put the fire out. And we didn't do this. And we can't clean up every mess made by the front line. So, it's up to the community. If this is what they want, that's what they're getting. And still yet, we see pictures sent every day of people that aren't doing what they should be doing. And, I was just looking at the numbers. Brita, you know how many people, we have almost 1,000. And I was looking at the recent JIC release, and do you know how many of those were in the under 60 age group? I mean, when we first started, we said, wow, the elderly are at risk, the people with comorbidities, and they are. But apparently that group is doing their job. But do you have any idea how many of those were under 60? Just a wild guess?
Probably none. Oh, under 60. No, under 60. A lot of them.
Under 60. I'm looking at the numbers off the JIC. It looks like out of, let's just say 1,000, about 850 are under age 60. About 500, 20 years of age to 40 years of age.
Mm-hmm.
I mean, I don't think people realize that. And that's the group committing the sins. But that's the group right there.
Yeah.
So, and how old was the one that just died in the hospital? 33?
34.
34?
Mm-hmm.
Yeah. So, you know, we started saying, you know, do what you need to do to protect your family, protect your relatives. I'll tell you what, you better do it to protect yourself, because the ones out there committing the infractions are the ones that's getting it and dying. The old people are staying home. And we have a really close friend, and he is staying home. His wife is staying home. They're elderly. They have a lot of medical issues. And sadly enough, the kids brought it in on them. And so, you know, our friend was infected because of the kids coming in. So if you're going to do it, don't leave everyone else alone. If you want to go out and do this and bring it in, don't involve anyone else in your plan, because they may not survive this. But this is frontline data right here. This is what you get when the breaches occur. And where will this stop? Depends on the front line. Ask them. We've done all we can do. We're just sitting here and watching this now. And it's like you let your kids play, then you see what they start doing. You have to ground them for a while. Well, the kids are allowed out there, and we're supposed to be responsible. When you see they're not, then they get grounded for a while. It's just simple. We have to clean up the mess. We have to put the fire out, and then everyone gets mad going, oh, we're grounded? Really? Well, do what you're supposed to do, and we all move on. Yeah. And I just can't preach that enough.
See you guys.
And we're getting pretty tired and pretty fed up, working 24 hours a day, trying to clean up these messes. And then people looking at us saying, what are you going to do? What are you going to do? What are you going to do? You did this. We didn't do this. You did this. So, you know, that's the message. And you're going to get whatever you invest. If you don't wear your mask, socially distance, and do what you're supposed to do, this is what you get. So, and we just watch the numbers every day. So, and our front lines are taking hits. Everyone's tired. You know, we've got a lot of frontliners still down, more getting infected.
Right.
And, you know, it's I don't know. I'll stop there, but I think my message and Dr. Nguyen's message is pretty clear. Are y'all there?
Yeah.
I mean, you guys done pissed off Dr. Manglona.
Exactly.
You know, the last
Mama Manglona is mad.
Huh?
And she's right. More than 40 of the new cases
God.
yesterday are in this young adult group.
Let's see here.
20 to 39 years old.
Yeah, and Doc, you know what I think is interesting is last night this number breakdown was going around on WhatsApp. I was getting it and I sent it to everybody, especially everybody I knew who's in that age bracket. So people are keying in on the numbers and the infections by age group. So I think that's
right.
I mean, it's important that people are paying attention to that.
Yeah, it seems like it's been quite a shift. When we first started, it was the elderly that was the target group. Mm-hmm. Now we're seeing it's younger and younger, not just here, but in the States too. And that's the group that's by and large the ones that are breaching the protocols. And I think they feel, we've all been there. We felt like we were so young and invincible, but I tell you what, COVID wasn't there then. You're not young. You're not invincible. COVID has no respect for who you think you are. You better believe that.
Doc, let's go to the comments if we could here. Emily writes, it's not just family gatherings stories, but the backlog of people tested and going around without results. Transparency and ownership, please, for the government's part in the contribution of the number of positives walking around out there without their results, and a mess of contact tracing and higher infection numbers. So basically people are saying, if we went and get tested and we're not getting the results, that's kind of on you guys. So how would you respond to that?
The test results are you're wearing the mask and going out and not socially distancing on you. So if you've got it and you're spreading it, that means you're breaching it. So if you think you have it, or you think you're at risk for having it, and you went and had a test, shut down till you get your test results. There so many people showed up. I mean, the numbers exceeded the capacity of daily running, but the onus is upon you. If you think you have it or may have it or been exposed, shut down. And if you do go out, God help you, but wear a mask and stay 20 feet away from people. I mean, the number doesn't change the situation, or the result doesn't change the situation. Whether you're positive or negative, do what you think you know you need to do right now while you're waiting on your results. And if you get a negative, go, wow, that's great. If it's positive, you say, thank God I did what I was told to do. Be responsible. I mean, so what's the result? You got the test because you thought you had it. Stop doing what you're doing, and you won't spread it. And then be happy if you get a negative, then you can carry on a little bit more, although you still have to go out and socially distance, wash your hands, and wear your mask, even if it's negative, because negative is only good that minute. The next day it could be as positive as the next person.
Right.
That's not a positive. You're pretty well done. You've got it. And we thought you might be protected for a few months. I noticed yesterday in the news, there was a case that got a second infection because the virus has, I guess, mutated because the genome was a little bit different. And a patient did get infected, not here. It was somewhere else.
Yeah, it was Hong Kong.
So, so now that's not good news to know that people can be reinfected with another strain. And that's going to likely impact vaccine making, because if you're gearing it to type A and then type B pops up, you have to shift. And maybe the procedure can make that transition easily. Maybe it can't. So if we're waiting on a vaccine, which we all are, we may have some nuances there as well, some bumps in the road with the vaccine production. But basically, if you just do what you need to do, you're at so much less of a risk. And yes, we're working on getting the positive and negatives, but till you hear that, till the bell rings, clamp down, do what you're supposed to do, and you won't have to worry if it's positive.
Doc, it kind of sounds like lockdown's going to be extended. I mean, if you're coming this way,
it kind of sounds like to me that the spread is going to be extended. The lockdown follows the spread. If you spread it, we lock down. We don't lock down, and then it's in a reaction to what the community is doing. If the community is surging, we lock down. So my question is, how long do you all plan to keep breaching it? If you keep breaching and the numbers surging, what do you think is going to happen? Do you think we're just going to pull the plug and say, ollie, ollie, in free, go ahead and spread it and let's see how many we can get infected? It's not like that. We hope it's not like that. We are hoping that we can put your fire out. And I say your, meaning the community, us too. I mean, we all take risk.
Yeah.
And a big thing too is, this is where a lot of people get it too. You feel comfortable in your home with your family. And there might just be two people there, one person there. That one person can spread it. Even though you followed the guidelines, you did what you're supposed to do, but you take your mask off to eat your dinner. So I would just invite you to just FaceTime people right now. You don't mingle, because you're at the mercy of whatever air they breathe when they walk in your door. So you hope they don't have it. And if there's a chance and you want them for dinner, make them sit at the end of the table as you eat when the masks are off. Right now, we've got a lot in the hospital, and we've got some still pouring in through the ER, and our hospitalization rate is high. We're just maxing out everything. And I think it's reality check time. And I think it's time that everyone trench in, lock down, and just stop. I hate to be on a soapbox like this, but
nah, go for it,
the
Doc.
numbers are scary. They're really scary. Where will this end? 70 or 80 a day? Really? That's not people doing what they're supposed to. And that's not the old timers. The old timers are sticking at home. They're not out playing bingo. They're staying at home by and large. So the numbers are surging. Yes, go ahead.
I was going to say, so that's it. It's the people of Guam's fault. The government has done all it can do. There's nothing more the government can do. It's just up to everybody out here. We're on our own.
No, yeah.
As far as the surge goes, we're all at the mercy of what's going on the front line. We sit and watch it. We can't control it. We try. You see gatherings, though. People bring in pictures and send them to us. We see what's going on. And all of us are at the mercy of the few. So if this is what you want, you're doing a fine job. But there's going to come a point where the governor isn't going to be able to clean up the mess as easily as you think. And I don't think any of us want to revisit Italy and New York and Guam. So if you're not afraid to go out, and if you're not afraid to spread it, then you haven't gotten the message. You don't get it. So, and and we talk about the death rate. It's not like the people just heal up and march on. So many are left with devastating disability for weeks to months. How much longer, we don't know, because it's new. But I've read stories where people say, I'll never run again. I can't even walk across the room without being short of breath because of permanent lung damage. Some of it is measurable and some of it is permanent. Some of it may resolve with time, like fatigue. We don't know. It's too new. But it's not a roll of the dice that you want to take, because we can't tell you what to expect. No one knows. People in China do. They've researched this for years, right on the street, apparently, where this virus was unleashed. Of course, the lab was down the street, but we're to believe it was a monkey or a bat or something. Okay, got it. But they probably have a lot of information and long-term studies that we have no access to because of their political system. But we're watching it play out. If it goes unchecked, this is what happens. So what can be done? We gear up. We try to put the fires out that the front line's causing us. The general came in and tried to clean up the mess and put everyone on lockdown. And then the masses cried, oh, no, you can't do this, really? So we just let you go rogue and kill everyone? I don't think so.
Doc.
Well, she had to do what she had to do.
Right.
Yes.
Well, we're up against the top of the hour, but I want to give you the floor, even though I kind of know what you're going to say. What's your advice to the governor?
My advice, both things. We'll do what we can to put the fires out. And are we still able? Yes, we have a shot at it. We do have a shot. We're gearing up our manpower, gearing up our testing capacity. We are trying to mobilize all the forces we can to clean this mess up. In the meantime, everything has to stop. It has to be shut down, because just like with tests, if we do 200 a day and 200 roll in, you don't make a lot of progress. So we're gearing up, trying to do more tests and trying to recruit other partners to help us, and that's working. But we've got to stop the influx. That's why the lid had to be put down. To clean it up, we've got to stop it and then sort of reset, like you reboot your computer and start over. And this time, do it right. We've got to do what we did when we first were hit with this. And we did a spectacular job, but everyone let their guard down. Everyone did. And now I have to tell everyone to please follow the protocol. Don't do mass gatherings. Don't have parties. Wear the mask. And if it's just a family member coming in for a dinner, scoot them down at the end of the table when they're eating and put a fan on. because they may be carrying it. And we all feel comfortable, and maybe you all, when the camera's off, maybe you take your mask off. I wouldn't. Oh, one of the people I felt the most comfortable around, I always took my mask off when I was with that one person, and that one person has it. So, thankfully they kept theirs on. So, it just, it's not trust. You've just got to look at everyone as a possible source of infection for you and your family. And don't go to your elderly's homes right now. Just chill out for about 1 to 2 weeks, and let's see where we are. But we're trying to clean up the mess. We're trying to put the fire out. It can be done, but this time we have to implore the front line to do their due diligence. And test results, we'll get those to you. But in the meantime, lock down, because if it's positive, you'll be glad you did. And if it's negative, if it's negative, then still you need to use your precautions. Sorry to be on a soapbox this morning, but we're in a begging position right now. We need the community to do what they have to do.
Thank you, Doc.
Thanks, Doc.
Guys, quit playing with matches. They're trying to put out this fire.
Thank you for your help in getting the message out. We don't do everything right, and we drop balls, but we're certainly trying to stay the course as much as we can with this unknown enemy. So thank you for giving us a platform to get the message out. Chris and Bree, we really appreciate it. Jason.
Thank you, Doc. Hang in there, okay?
Yeah.
We're here for you.
Okay,
Give me a text. All right.
we'll do it.
Okay.
Thanks.
Take care.
Wash your
Bye.
hands. Yeah.
That was heavy.
Yeah.
She's the nicest person in the
Yeah,
world.
that was she's always joking, and I feel like it's just finally getting to a lot of these frontliners, especially seeing that protest yesterday. I'm pretty sure that just made it hit way different when you have these COVID deniers out there saying, "Oh, it's just like the flu." It's just really, and I think the clapback to these protests. If you go on our comments for the Instagram, it's crazy.
Mm-hmm.
I mean, pretty much every comment is like, "What are you guys doing?" And I think it really goes back to that sense of, like, we keep talking about the community. Like, even if we're all the community, right? And I think that's where a lot of us who have lived here, grown here, even been born here, that's kind of our mindset as we look out for each other. And, going back to what I said about individual on Guam, I think for the most part, we don't view ourselves as individual. We view ourselves as a body, right? And so we just need to get our together. 7:56. We're going to sign off on KUAM TV 11 because I want to get Miss Maria Pangolino, the Guam Election Commission, in. I think if they're trying to cancel or postpone the primary, maybe just send whoever is going to make the decisions a copy of Dr. Manglona's interview.